Did not sign the budget that passed in the General Assembly last week. Even so, it became law today.
And part of that budget increased taxes on cigarettes, but as News Channel 8's Andy Rourke found out, the state is increasing the cost, but is not spending more on helping those who want to quit.
Keith and Ann, Democrats and Republicans alike jumped on the cigarette tax as a way to balance the budget in a cash-strapped year. The habit will bring in $500,000 to state coffers, but it will cost us $1 billion in health-related costs. So some say we're being penny-wise and pound-foolish. And smokers, well, they're just fed up with being a target.
It's going to cost me a lot of money. I won't pay it.
Leah Charney is a woman on a mission.
These are just the filters and the plain paper.
She's buying tobacco, rolling papers, and a machine. She plans to roll her own from here on out, an act of defiance against yet another tax increase on cigarettes.
I'm not paying all that money. I pay enough in taxes.
The tax is now $3 a pack, the second highest in the country, something anti-smoking advocates say is a good thing.
Raising the cost of cigarettes and tobacco products has been shown by research to be one of the most effective ways that you can reduce smoking.
But Kevin O'Flaherty says the state is missing a golden opportunity because we have no programs to help smokers quit, and it shows.
The most recent data for Connecticut shows that over 20% of high school youth smoke. In New York City, that number is 8.5%.
This addiction actually brings in $500 million every year between the taxes and the tobacco settlement money. The Attorney General was instrumental in bringing the lawsuit against Big Tobacco. He says it was always the intention that at least some of that money would go to help smokers quit.
Unfortunately, our legislature and our governors have failed to fulfill the promise of that settlement. We should be embarrassed and ashamed.
Leaving longtime smokers just looking for ways to get around the taxes. Charney has been smoking 2 packs a day for 30 years and doesn't plan to quit. But she says she would consider it if the state offered help.
If I could get it for free, I'd probably try it.
Rhode Island is now requiring private insurers to cover smoking cessation programs. That doesn't cost taxpayers anything at all. We are also one of only 6 states where Medicaid doesn't cover any programs, and that is money that would be matched by federal funds. But our state has shut down the quit line and has